We would like to welcome everybody who has joined us for the very special webinar that Biogal is sponsoring today. Our guest speaker is a very distinguished veterinarian named Dr. Brad Roach.
Good afternoon. We'll just get our slideshow all lined up here. I'm here to talk to you about something that's very practical, and it's something that we're going to be sharing on how to actually get in the trenches and fill a niche in the market that's really needed these days. And so the benefits of titer testing in general practice. We'll go to the next slide and just talk about a little bit about my background. You read a lot of stuff about holistic medicine, but you know, most of my income is just good old conventional integrative medicine. And I was a 1990 graduate. It's hard to believe that I've been out of school 30 years because I'm just so excited about what we're doing here. And I own 2 practices, so you're not going to hear from a professor or anybody that's ivory tower. I'm in the trenches, and we're doing this for real. And I went ahead and got certified in acupuncture and in chiropractic, and so just to give myself more tools. And I think you'll find out that I'm going to try to equip you guys with a new tool as well. I'm an innovator of holistic modalities. We combine all this stuff together and just create some really good patient outcomes. And but I'm a clinician first. If it doesn't work, I'm not going to do it. I'm a business owner second. And so if it doesn't pay me to do it, I'm not going to do that either. And so I think those are important points when we're talking about VacciCheck and the vaccine titering, because my experience here is I've done over 1,600 of these tests, and they've just provided my practice and myself and my staff with the really good options and really neat things to kind of look at. So let's get right on with the slide. And so we'll talk about some clinical experience I have with VacciCheck, and then talk about some vaccine guideline changes and how to integrate this into your pet wellness programs. And then indications of when to actually do the titering is going to also be helpful for you. And client concerns have driven some trends in vaccination, and we'll talk about that, and then give you some clinical examples and how to implement this in your practice. So next slide. And then, so, you know, back in 1990, way back then, I mean, that doesn't seem that long ago, but for me, good medicine was good business back then. And that's when everybody was getting new blood machines and offering, you know, great services from the in-clinic viewpoint and not sending things out to reference lab. Go ahead. And the changes and the changes that came down the pike in the next few years, and I think a lot of you can identify with this, and the changes, go ahead and advance into the, able to give us a little, whether it was a change in vaccine protocols. And so, and this started back in the 90s and the early 2000s. And so the clients will actually depend on vaccinations. And this webinar is meant for both clients and veterinarians. And I think if you're a client, you'll realize that you actually did depend on those reminders to tell you when to come in. And we all know that that's not the best way to do things, even though that's the veterinarian relied on it, the clients relied on it, but really it was good to have, you know, just to bring those pets in for routine screenings, for finding those bumps and those lumps and those earaches and those teeth that need to be taken out, a whole lot better than just getting them in for an injection. But the whole vaccine changing thing happened, and it kind of had a lot of veterinarians back on their heels going like, well, what do we do if we have less patient visits? And so when we got that kind of situation going on, we have a lot of fear in the marketplace, and the inability of a big group of veterinarians who are generally pretty conservative to embrace a change. And because we still know that it's still best for that pet to be seen, even if it's to remind for an injection. And so and then we're finding out that the injections are not all that needed, and it kind of threatens a lot of people in practice. And I hope as a one in the trenches today, I can show you that just go ahead and embrace this change and give you some tools to get through it. And all it takes is some training of your staff, and the cost controls are going to be great for you to embrace this. You're not going to have to buy any lab equipment or anything like that. And so Let's go to the next slide. And so, so the changes in trends that happen to us in our practice can also be beneficial actually for the practice. And so when we add vaccine titer testing, it provides opportunities for practice growth and better patient outcomes. And so there's really no reason to be fearful of these changes. And so that's my main message is just go ahead and we have tools now where we can actually embrace these changes and do it scientifically. Next slide, please. And then, so you'll find out as we go along that it's very comparable to other in-house health screens. Go ahead and advance. We have something below there. And the problem is, you know, when I was sending vaccine titers off to reference labs, it was costing my clients almost $200. And I have one of my practices is a holistic pet care center, and people would come to that practice and want to run these titers, and I would just almost hate sending that test in because it costs so much to do that. But we're running these tests now in-house for half the cost to the client, cheaper than what we can pay for it as a veterinarian and a reference lab. And so, and that's including, you know, client tech time and preparation time and everything. And so it's very cost effective for the client and the provider, and allows people to be able to get these tests done with hardly any other special blood tubes or anything, and very minimal training to actually perform these tests. It can be done in about 22 minutes without any special equipment purchase or anything. And so what I did in my practice to gain client trust is that I wanted to show awareness that clients were concerned about this. And, you know, I get clients in my practice that actually come from other practices and they've said that they were just ignored by their veterinarian. And please don't do that, because these clients are really concerned about that. You're not going to change their mind by telling them that it's not true, because they have experiences that you don't have. And so to really validate client concerns about vaccines is going to help you gain their trust. And it also allows you to provide best options for each pet, because not everyone is the same. You know as well as I do as a veterinarian, you have this little house dog that comes in, never goes anywhere, never goes camping, never goes to the grooming shop. Those animals don't need a lot of vaccination or even a lot of protection. But then you have the dog that goes camping and goes to different areas of the country, and they're all over the place, and they're going to shows. And that particular patient is going to need to know for sure if they're protected, and also have vaccines to the hilt. And so in the process of gaining the client's trust, also, when I remind people for their vaccines, I actually remind to come in to see if it's a vaccine year. If it's not really time to vaccinate their animals, I still get the annual exam done, the heartworm test, and everything else I need to get done. But we're deciding if it's a vaccine year for that particular disease entity, whether it's a rabies year, whether it's a distemper parvo year, or just a test instead. And so I will give them actually a discount on their annual exam if they do not do the vaccines. And it's minimal discount, but it makes them feel like I'm not taking advantage by just charging them for the annual, and they don't get the vaccine, they get a test. So it kind of helps them realize that I'm not out just for the money. We're trying to do the best thing for the pet possible. And then there are a few occasions where we find out that the vaccines are actually needed, and we run that test, and the test is low, and then I'm going to do that for free on these patients. And the idea there is that there's not going to be double jeopardy on the money. If you need to have the vaccine done, I'm doing it for free. And it just helps seal the deal to say, hey, you know, we're actually going to do what's best for your pet. We don't even, money aside from anything, we're not going to make you pay for the test and the vaccine. Now, some veterinarians will say, you know, this is not the veterinarian's fault that the animal needs to be revaccinated. So you can make your own decisions in practice if you want to charge for that or not. But I think it helps gain the trust, and they're not going to need to worry about that. One more note on that, we can stay on this slide, but when I'm going to revaccinate an animal, I actually put them on supplements and things like that to help their immune system try to respond better to what we're doing, because sometimes it takes several weeks of just getting their immune system up to a better point to react to a vaccine. So, and then so why did all these changes come about? And basically, it was driven by the organizations AHA and the feline practitioners and the World Society of Veterinarians. And there's a lot of organizations that started changing their protocols because of the things that they were finding out about immunity. And at the same time, we have a perfect storm brewing because of changing client concerns as well happened as well. And we'll discuss a little bit of that in the next slide or two. This article from VPN sort of described, you know, why this 3-year change started happening and how everything started shifting. And we'll take a few quotes from that in the next slide or two. Professor Ford was he's very active in this field, and if you want to get a really good scientific presentation, it's on YouTube, and you can get the address from the Biogal guys here when we get done. But that's a really nice immunology lecture about that. And so, and he's just basically states that the science is abundantly clear. You know, some vaccines are going to need to be annually sustained at a reasonable level of protection, but namely these core vaccines usually offer, you know, protective immunity for dogs and cats, and there's just no medical justification that we need to be administering all the core vaccines to all animals annually. And so that was a pretty clear quote from that VPN article from Professor Ford. But like I said, he put together a really nice, a very technical piece earlier this year or at the end of last year, and it really should go to YouTube and watch that because it's really neat. Okay, next slide. And then, so we'll just talk a little bit about the core vaccines. These are the vaccines that are required by every dog in order to protect them from life-threatening illnesses and things like that are prevalent throughout the world. And there are some clients that are watching, and not just veterinarians, so I'll just take a few minutes to diverge a little bit and talk about there is a difference between core and non-core vaccines. And so usually when you finish up the puppy series and go to the 12-month booster, and then every 3 years is sort of the definition on what to do with the core diseases these days. And, you know, the parvo, distemper, things like that. And then the non-core vaccines are going to be required by animals whose geographical location or their lifestyle puts them at risk for other things like Lyme disease and things like that. So in my area, we have no Lyme. We're not going to vaccinate for that or consider it core. I think California just changed their core vaccine list to include leptospirosis. In my practice, we don't see a lot of that, and so we don't usually try to vaccinate for that. But a lot of people in Texas and other places like that consider it part of their core. So just it does depend on geographics here, and so if your client kind of confused about that, you just need to ask your veterinarian about what's core, what's non-core, and that kind of thing. Okay. And then so that's a little bit about that. And then the vaccine concerns started, we'll go next slide, when this article came out. It was about when I first started hearing a lot about the vaccine problems in clients' minds. And it was done in 1998 by Dr. Wakefield. And he started seeing an association between autism and vaccines. And I'm not saying that that is not true, but this study had some problems because it did not have really good statistics in it. There was not a control group. They relied a lot on phone calls and people's memories. And it just had some real vague conclusions, but it just stuck in people's minds. And I'm not saying this doesn't happen, but I am saying that this particular thing had some weaknesses that caused it to be retracted a few years later. Go ahead and expand. So there is a link between vaccine and autoimmune issues. I'm sure of it, because every time we vaccinate, we do upregulate the immune system in some ways, and everyone knows it, but we don't want to talk, and sometimes it doesn't even show up, but we tend to vaccinate animals until they're very old, like 18, 19, 20 years old. They don't have vaccines anymore, guys. So let's go ahead and pull the next. So this is a open the next one. We're subjecting pets to constant and repeated exposures to chemicals and drugs. There's a quote from Dr. Dodds, and Jean Dodds is in California, and she believes that vaccines are not clean, pure products. She says they contain remnants of tissue cultures and other chemicals. Dr. Dodds believes these are toxic tissue cultures being injected into animals. And there's a few intranasal vaccines, but most are injected. And that was in that one paper from VPN in 2015. So my point is not to get everybody worked up about this. I'm just saying there are there's plenty of research out there to show that we should not be just doing it as an indiscriminate act of arbitrary, yearly things, and that we really need to consider whether the vaccines are actually needed. And by offering this test, it totally allows a veterinarian to have options and not just be kind of locked into that paradigm. The next slide. And then, so for an example, this is Christina. This cat is 25 years old. I mean, I used to see cats and dogs this old back in the 90s, but it seems like I'm not seeing that many of them anymore. And she had claimed that her children had been vaccine injured. And it took her years and a very long journey, nutrition, and just good health care to get her kids back. And she wasn't about to let me vaccinate this really old cat. And so if you can make room for people like her in your practice, you'll have volumes of referrals. These people will talk about this. And so I think it's a great way to embrace their reality and just allow that to happen. And so this cat, unfortunately, could have probably lived a lot longer, but had an accident with the dog and it didn't turn out too good. But anyways, we did alleviate her concerns about not enforcing vaccines on her for that reason, and that's why she was my client, because we didn't enforce the vaccine on her for reasons of geriatric, issues. So Max, we'll go on to another clinical example of a dog that had come to me because I didn't offer the same vaccination protocols. Max was only 1.5 years old, and after a week of being vaccinated, he was clinically ill. And he was actually had a lot of tests done, and it turned out that he had lymphoblastic leukemia. And so I'm not saying the vaccines caused this problem with Max, but definitely triggered something in his whole health situation that was a problem for him. And this happened in about November of this last year, and by the mid-January of this year, he was gone. And so we just another example of a potential problem with just treating all dogs the same and just vaccinating indiscriminately. Now here's an example of 2 Boston Terrier puppies who came to me. The owner had actually had a problem because a previous pet of hers, also a Boston, had passed from cancer. And she came to me and was very adamant about not using too many vaccines, and we did a very minimal vaccination and was able to use Vaccicheck to let us know if we had done enough. And so that was, let me just go to the next slide and show you how that can be used. And I'm not just talking about using Vaccicheck but because other veterinarians are saying to do it, but actually AHA recommends it. Go to the next slide. So next slide, please. Right, there we go. So this is sort of an algorithm of how we do our puppy titer testing after the initial vaccination. After they're done, we're going to go ahead and determine whether they've converted on to positive or negative at that point. If they're positive, of course, you can go into at every 3-year mode. Well, what I normally do is go ahead and rebooster as an adult one more time, and then go into a 3-year mode. And then if they're negative, you can repeat the vaccination using a different product if you'd like. And like I said before, you can also offer supplements or other things that might help you. And then just repeat the serology again. If they're positive, they're good. If not, then you have a non-responder. And sometimes those are still protected by CMI, but or cellular immediate immunity, but they're likely to be unprotected. And this makes people realize, and it brings up the opportunity for the clinician to actually say, okay, there's a difference between vaccinating and immunizing, and it totally becomes clear to them at that point whether they've, vaccinating is putting the injection in, and immunizing is actually the body's making its response to what you did. And this test definitely allows you to figure that out. Next slide. And so, so the benefits of doing this, it just allows you to decrease exposure when you suspect that things may or may not be needed, and it gives you an important tool to detect in your patient's immunity and protection levels. And let's talk about when titer testing is an option based on, even the next slide would be based on the AHA and WSAVA vaccination guidelines. They actually mention to do these tests. And like we said before, it's great for determining when a puppy or kitten has responded to vaccines. It's really good for testing newly adoptions to make sure that when their vaccine has been unknown, make sure they're well on their way. To use titer testing instead of just automatically going into 3-year vaccination protocols. And so we just would substitute that for the vaccine at the 3rd year. Some people want to know every year, and it's really not a bad idea to see, especially if they're kind of falling down below, to just check every year. And if the client doesn't mind, we just go ahead and do it along with the heartworm testing that we do. And in some shelter situations, if they start having an outbreak, I've heard that they just start putting down some of these parvo dogs, but this is a good way to actually take this situation of an outbreak and see if the dogs are protected within that shelter, and those dogs can stay. So that's the guidelines for usage. And go to the next slide. So VacciCheck is an in-clinic test for running the core vaccine levels, and for parvo and distemper and hepatitis. On the feline side, the panleukopenia is all we have on the U.S. market, not the Khaleesi or the herpes. So that should have just read panleukopenia there for us. And so it does really encourage us to be wise and immunize, but immunize wisely. And so these are some real current trends in practice situations. And let's look at the test a little bit on the next slide. And what it actually tests for is when you have a pathogen that infects the body, it's going to have a quick rise there of exposure. Then the next, it's going to be IgM. And IgM is the first antibody that's going to respond. And then after that, you're going to get the rise of IgG titers to indicate the long-term memory, effect of the immune system. And so what we're shooting for here on the VacciCheck test is the IgG antibody. And immunologist after immunologist, Dr. Ron Schultz, Dr. Richard Ford, will tell you that it's very correlative for these canine vaccines, for parvo, distemper, adenovirus. If the antibody's high, then you have protection. Now that's not true with rabies. I get asked that every day. Why can't we just check for rabies? Well, first of all, it's in most of our states' laws that we have to have at least a 3-year done for that. And secondly, there is more to rabies than just IgG antibody protection. And they have actually challenged dogs with rabies that have been vaccinated twice before, and they've come down with rabies. If they have high antibodies, they can still come down with the rabies virus. So there's more to it than just the antibody. Next slide. And so when we measure this, the combs, or the little places, little test wells, we're going to have these combs, and the combs will have the antigen on the little round circles, and the antigens are what's going to take in the antibody. And the ELISA testing will put the conjugate into that solution and then wash it away, and so you get a very quantitative result. So just wanted you to realize that we're measuring color here and through the ELISA system, and it's really nice to know. It's real easy to read the results. Next slide. And so when I do these testings, I just do them as a batch, because you take a test for a heartworm test and you put it in your EDTA tubes. That's the same blood sample that we're going to use for the vaccine check. And the test kit is to the right, and it looks kind of like this. You're just going to advance the comb through those wells with certain timed intervals, and it's simple to run. It takes about 22 or 25 minutes, something like that. And it's you don't have to have you do need to wait till this little developing plate warms up a little bit, but there's really no issues with equipment or anything like that at this point, and it's really nice test to run. Any technician can do it. Now, when we batch them, sometimes we're running 8, 9, 10 of these at a time, and then we just send the client a little letter that says that they tested well for these 3 diseases, and it gives them numbers. And I tell people, you're going to get an exact number from 1 to 6 on what your antibody level is, and we can talk about it after that. If you need me to call a grooming place or a boarding kennel, I can always call them for you and tell them it's the new way. This is the way we're doing it. We're measuring immunity to these diseases instead of over-vaccinating. Next slide. And so this is a little bit more about how you can actually do it by putting the blood in the front row and then just moving the comb through the wells. It's very simple to run, and then you just measure the color compared to a chart. And next slide, come up with some results. Now, we call this semi-quantitatively by just comparing it to a scale. In the future, I think there's some neat things coming out as far as being able to use a little camera to read some of these for more exact comparisons to the numbers. And about the results on the next slide, we'll talk about that. Like I said, you're going to get a 1 to 6 number, and that's going to be anything above a 3. I consider protected. If they're a 0 to a 2, I'm going to revaccinate those animals. And I know some people say that they're protected if they engage at all and have a 1 or a 2. Realize that, but I'm not going to ignore my results. And if I'm calling them a weak positive, I'm going to go ahead and revaccinate those animals to get their antibody back up. So now I will say at this point, I first started using this test to determine whether I need to vaccinate an animal or not. I did not realize I would find so many non-responders or low. We have patients that are the little poodles that are going to grooming places and going to boarding kennels that are totally unprotected for parvo or totally unprotected for distemper. And I did not really expect that, but we're finding that whole population of dogs out there. I'm not saying it's a whole lot, but probably, I don't know, maybe 3 or 4 out of 100 are going to be really, really low. And so, anyways, next slide. So we can also use the guidelines from AHA to help us with our internal marketing campaigns. And we'll go on to the next one, and we'll just flip through these. Again, we've already mentioned them once. The first one is, when you've done with your vaccines and you've got that initial set of vaccines done, go ahead and test them at 6 months. And then when you're trying to assess the immunity of a prior vaccine history and they're due for a booster, that's a really good time to go ahead and offer that. And then the next one. So to assess whether the pets, that there's their unknown history and you don't really know if they've been vaccinated at all, this is a good time to check it out, like from a shelter. And next. And the pre-breeding assessment of immunity is important, I think, too, because sometimes, these guys these dogs are being bred and they're not actually protected, and they're not going to have a lot of antibody to pass on to their puppies. And so if I have a breeding situation, I'm going to recommend, if you want me to check for vaccine, for the ability of your mama dog to pass on antibodies to those babies, let's go ahead and test. And we have a high number of those people that'll go ahead and say yes. And then 2 more, let's see. To identify whether you've got a non-responder or not, like I said, I've already mentioned this once a little bit about finding those dogs kind of surprising every once in a while that they will come up as a non-responder. And those dogs we just have to keep totally sequestered basically from any type of grooming or other animal exposure. And lastly, the assessment of the shelter house dogs to see if they're safe enough to stay there. And I know a lot of shelters may not be able to afford this, but you'd be surprised, you know, how it might help some shelters to manage their populations of animals by knowing whether they're protected for these core diseases. Okay, next. So let me just run through a little bit about marketing. It's always a challenge in a veterinary practice to market things, and I found a magazine that kind of worked for my practice, and we'll show the next couple slides and just talk about. We have this one called Natural Awakenings that I was featured on, and I was able to actually put a plug in about the vaccine situation on the next slide. And basically, we just said, you know, this is a new option, a vaccine measurement with the use of titers and in-house blood tests made by Vaccination to measure the antibodies for parvo, distemper, hepatitis, and feline panleukopenia. So I firmly believe this is a new standard of preventive medicine. There's no reason to over-vaccinate older pets as they age. The test can also measure effectiveness of puppies. So we've already mentioned all this, but clients are really, you'll be surprised how relieved people are to know that this option is out there. And I think you're going to find that if you get a reputation in your practice for doing what's needed, and they will be relieved to know that they don't have to overdo this. And the next slide is just an example of an advertisement that we were able to put out there about Titers, and just offering a little bit of a discount to try to get people to come in. And so going back a couple slides, we'll go back to that other, the list about the different things. There we go. So social media is one of the things that have been used before, and I've heard you could actually say if you like us and you say that your pet was tested instead of vaccinated today, you know, we'll give you a free nail trim or whatever. So there's all kinds of ideas, and social media wasn't really in my I'm not culturally smart like that sometimes, and I have to have a lot of help on the social media. And some of y'all out there could really probably put together a neat program on that. And the reminder cards that we send out, we send the postcards out, just have to make sure that the reminder for this particular service will satisfy the reminder that was sent for a vaccine booster. Because if you don't put in there that this satisfies that thing, then they're going to get a vaccine test one month, and the next month get another reminder for not having done their vaccine yet. And so you just have to have your IT guys or whoever's managing your computer system to make sure that that part of it works. And just, I'm encouraging people that are listening to this webinar to be a little bit proactive, and don't wait till the clients find out about this online and come to you and asking you if you'll do it, and then kind of being back on your heels like, well, I didn't know that that could be done. It just makes you look like you're on top of things and you're validating their concerns. And there again, just keep your reminders updated. And another idea, the last thing I have here is about signage, and you can be real creative with signage. So worried about shots, you know, we can test. And just use a little funny thing. I have more people follow this sign than I have people that use my digital sign at another practice. And we get more comments about the funny things we put up on this sign than about practically anything I've used before for outdoor signage. So, okay.
Dr. Roach, you have given a great presentation, and you've actually generated a tremendous number of questions. So let's go ahead and start with them. The first question might be a little tricky here. How do you deal with state or city regulations that mandate vaccinations?
The only state or city vaccinations that can be mandated usually relate to rabies. I don't know of any city or state that has a mandate for distemper parvo or any of the other core vaccinations. Because of the public health risk of rabies, that's where that has come from. And we just have to follow whatever those regulations are. And some of my clients tell me just flat out, no, I'm not going to do it. And I said, well, that's on you. At least I've told you what you need to do as a veterinarian. And if they have concerns about that, they can take it up with those entities. But I don't go to bat for them against the state. I don't write any letters to exempt them because it just won't work very well. I wish there was exemptions for dogs with cancers and seizures and things like that, but we're not in that day and time yet. Dr. Dodds is very involved in a rabies challenge study where they actually vaccinated dogs twice for rabies about 10 years ago, and they challenge them every year with rabies virus, and they're still not dying. I mean, they're living through these trials every year. So I think there's a lot of research and a lot of push right now to change the rabies laws, but I don't think that's going to happen in my practice career, but it might in some of you young guys.
Great, thank you. We have Mercedes, who's asking if a pet parent is not familiar with vaccine titer testing, do you offer to educate them about this option?
Yes, that's a good question. We try to educate them starting with the phone call, and I think with any good service that you offer, a lot of times they have to hear it multiple times. So if they hear from a receptionist about there are options in vaccination, but I'll let the doctor discuss that with you, and it gets them thinking about, wow, I've got options. And then as they come in, the technician's going to mention, well, let's decide if it's going to be a vaccine year or not. And if it is a vaccine year, then we go ahead and do it. If it's not, then we can test, and it may wind up being a vaccine year anyways based on the test, but let's find out and not just leave it up to chance. And so and usually just by telling them, well, let's just test and make sure that it's the dog is protected. And I'm telling you, you would not believe the amount of relief that you'll get from your clients by just offering this. And I'm not sure if it's my practice that would be when I'm used to seeing holistic clients or not, but I think you'll find that there is a general distrust for pharmacy and for vaccines and a lot of things like that these days. And so you will be showing that you're aware of these concerns and these client concerns for vaccination by offering this test. And it's so easy. You can actually do it, individually if you want to. You can just take one of those little combs and run it right through. So if I have a client that has a boarding appointment like tomorrow, and they want to get their test done soon enough to have a little form to show people, then I'll just run that through that same day and not batch it. So you can make your choice up as to whether you're going to batch it, and you can decide if you're going to send out a certificate, or you could decide if you're going to just give a phone call. So
Great.
Good question.
Yep, great answer there. Audra has a question, which is, how often are you rechecking protective or positive titers? And she's looking for some guidance on what you would recommend. And do you have a different response if you get a very strong positive titer?
Good question. On if an animal comes in the previous year and they tested all 5s and 6s, I'm going to recommend that we not test that year. And I just say, let's spend that money on this dog's mouth or this dog's dental issue, or there's a tumor here. Let's spend that money instead on something this dog really needs, and I'll skip a year. Sometimes even several years if they're all 6s and 5s. So that just depends on the client. And then I've done also titers on animals that one year they're 5s and the next year they come in at 4s and 3s, and so it's something that I might want to watch in that animal as the protection seems to wane. And I think a lot of immunologists will say whether you've really got a responder or a non-responder, and it doesn't matter, if you respond at all, you're still positive. And to that, I would say some of these diseases require a fast antibody response to fight them off, because when you have a really short incubation period of parvo or something like that, you're going to have to have a really fast antibody response rate. And when they get down into the 1s and 2s, I'm just not comfortable leaving the animal like that. And so I will, if I see that they're in 3s, I'll definitely want to retest the following year.
Great. That's some very good advice. Thank you, Dr. Roach. Another great question here. This one comes from Wendy, and the question is, if you have a vaccinated dog, are you finding that they are generally demonstrating protective titers? And if the answer is no, she's asking you, are you finding that the vaccine company will take responsibility for a lack of protective vaccine titer?
So, well, I wish I wish they would, but basically, if I find that an animal is positive at all, they're usually well protected, and I've never had a situation where one of them tested high and then got sick from any of the core diseases. So I can't really address that, but I have had dogs that have come in for 1 or 2 of the puppy shots and then been switched to a training situation and didn't get the 3rd shot, and those sometimes will get sick. And in those instances, the vaccine company that I use will still even cover that. I don't know why they would. They don't have to, but I've had them cover, whole litters of puppies in that situation where they started vaccinating and didn't finish the series. And so, and that's not real common, but I do think we have some maternal blocking of the antibodies early on, and you're not going to be seroconverting those until 14 to 16 weeks, and that's why we go out to that time, and that's also why we test those puppies. And people who are in that business really know what we're talking about as far as making sure that they're immunized and not just vaccinated.
Excellent. Thank you. Another very popular question. A number of people have asked this question, Dr. Roach, but Keith was the first one to ask. If the titers are normal, and I assume that Keith means if they are protective, and there is no need for a vaccine, how do I tell my client that it will still be normal or protective in 3, 6, 9, or 12 months?
Well, you're not able to make any real predictive qualifications there, but I do think that there's not a whole lot of things within an immune system that can, quote unquote, use up an antibody level. And so I don't really, I haven't had that problem come up, and I don't think it's something you'll have to worry about. Basically, just if you're worried about them and does have a falling titer, you'll find out next year. And if they've got, like I said, all 5s and 6s, I'm not going to worry too much about even doing it the next year, but I will make a note in the chart to run the test the following year. And so it's just something that I'm going to keep in mind. Now, the AHA guidelines, and they're going to recommend triennial boosters or testing. And so for me, when I'm seeing them get down into 3s, I just don't like to see them drop down into the low range.
Great. We had several people, specifically Zoran, Dawn, and Keith, ask about the cost of the test. And I realized that because this is an international presentation, there may be some different cost structure. But can you speak at least to the cost differential for you in the United States? In other words, how much does this cost you relative to using an outside reference laboratory?
I would say that I actually charge my clients around $70 to run this test, and that's you can make enough to pay for your tech time and your sample prep and everything with that price. And if I were to send it out to external laboratory, my actual cost to measure all 3 diseases, well, I think was like 160 on one test from IDEX. PCR testing, get it done for client costs about 140. So about 140, $150 is what you can get a parvo and distemper run. You don't get adenovirus with that. And so you're going to have to charge a client $140 or $150 to send these tests out. And the results that we're getting with this in-house test is way simpler, way cheaper, and provides enough profit for the practice to not do those vaccines. And that's where we have to look out for practice health and actually you have to look out for the patient health too, but the practice health is important because you're not going to be there to offer services when the animal gets sick if you can't maintain the practice health as well. So believe me, you can offer the price now in New York. You might have to charge $95 for this test and you'll still come out okay. And so, but the test kits, I think it just depends because that's hard to answer the question because different distributors now carry this test and we don't have to order it from home office anywhere. So, yeah, and that's one selling point that I've used on this test, that there's enough R&D that's gone into this that they've made an in-house kit. And that has a lot of validity to be able to test in-house. That just proves to me that the R&D has been well done. And it's just, I think, a whole new tool to allow us to choose better health outcomes for our patients.
Great. And for our guests who are not from the United States, if you are interested in learning more about how you can access or purchase Vaccicheck in your country, please send your information in the question and answer box in the on your screen. Dr. Roach, I don't know what it is that you got some kind of magic potion, but we are just bursting at the seams with fantastic questions here. The next one is from Wendy, and it may have been when the audio on your computer was acting up a little bit, but I know you touched upon it, but she wasn't able to hear it. The question is, how long does the test take to run?
The test is under 25 minutes. If I, this is one of those things I just say, text, you guys can do that, and they can run 10 tests in 25, 30 minutes max. And so it's really nice in-house test. It's not like a snap test on the heartworm where you can just snap it down and read each one of them in 8 minutes, but it does, for me in my practice, it works really well to do them on Wednesdays, and it gives us plenty of time to just batch them together, and they're done in the same vial as a heartworm EDTA test, so it's really handy too. Sometimes I'll go back and say, hey, we've already drawn blood from your dog, but if you want me to test this, we've already got enough blood to run it from the heartworm test, and a lot of times that's enough just to convince the client that, yeah, let's go ahead and do it.
Great. I have just received notification from our engineering room that we have time for one more question. Gosh, I don't know which one to ask, but here's a great one from Cindy. And for those of you who we have not been able to get to your questions, I promise you we will be following up with each of you. Obviously, the volume of questions generated is a function of the quality of our presenter, Dr. Roach. But Cindy had asked a question, and it's a fairly popular one, Dr. Roach. It's, how often are you recommending to Vaccicheck test a given patient? Annually, question mark. And then if you use test titers, how do you issue a due date for the next vaccination for boarding and or grooming facilities?
Okay, good question. The boarding and grooming facilities I have found are not all that fond about triennial vaccine measurements. So on ones that I know they're going to be going to grooming and boarding, I'm going to test them probably every year. And that way they'll have a fresh look at it each year about the level of immunity. And so they may not understand the triennial need for it. And sometimes I'm not even that comfortable with waiting 2 or 3 years. And so if I have a pet that's that I think is immunocompromised or is sick for some reason, I'm probably going to go ahead and test those patients too every year. And I think the cost of the vaccine or the Vaccicheck is such a minimal thing compared to what it used to be, that it doesn't hurt to go ahead and do it every single year. And like I said, when we've done that before, sometimes we find these falling titers over time, and it's really interesting to kind of watch them.
Yeah, and in fact, Dr. Roach, up here in the New York City metropolitan area, the veterinarians who are using VaccCheck are very comfortable in using this annually because they just don't want to take any chances. So I think they would concur with what you had to say.
Yep.
All right. Well, folks, this has just been a wonderful webinar. We at Biogal are so grateful to Dr. Roach for being a great lecturer who dispensed some truly valuable clinical information. We hope that all of you will be able to take these pearls of wisdom and be able to apply them in your practice.
You're welcome. I would also mention that one more time, if it's not too late, Dr. Richard Ford has a really great YouTube video, one of these that's done before. And if you're a practitioner, but you're not the decision maker in your clinic, I think this will help them make that decision and start to kind of piece together the scientific part of what we're doing here. My main goal is to let you know in the trenches, in the clinical setting, this really does work monetarily, and it works for the patient's outcome. And so I'm just glad that I was able to share my passion with you guys, and I hope to, I'll be glad to answer questions too. And so just let me know.